The future still is in molecular subsetting of metastatic urothelial cancer. My practice is to offer genomic tumor sequencing to all patients with metastatic disease. I do it when patients are immediately hit that metastatic frontline setting. So while they're getting their platinum-based chemotherapy, I'm doing genomic molecular testing from one of many now various laboratories that can do that. And I use that information to identify genomic targets that we now have clinical trials for. So for example, patients with HER2 or ERB family alterations can be eligible for clinical trials, and there's been data that's been published that has shown promise for those patients. Patients with DNA repair mutations, there's now PARP inhibitors that can target those patients, and trials are ongoing looking at those segments. And then it may have directly a role to then set your patient up for FGFR3 inhibitor therapy if that drug is approved. In the past, in the recent past, those patients who have FGFR alterations then have been eligible for those trials. So in my experience, it's been a very effective tool to genomically sequence patients because it has allowed patients to be eligible for trials that are going to help us move the field forward.